Welcome back. This is Dr. Phil Rosori, Medical Director of Village Hope Corps International. This is part two. Let's start where we left off. We're looking at the population in Kenya. 30 years ago when I first went to Kenya, 18 million people, now 44 million people when I was just in Kenya. And at 2050, half century, which is going to be our time horizon for Village Hope Corps International's development and health projects, there's going to be 80 to 90 million people in Kenya. So obviously this is extremely important. Now, in 2050, there is going to be probably 39% of all children in the planet are going to be on the African continent. Some initial studies show that it would be 45%, but looking at the new United Nations population data, it looks more like 39%, but it doesn't make any difference really. It is a huge amount of the children. And you think of 39% of all the children in the world being on the African continent, the continent that has the least resources to deal with them. That is a very significant thing for us because it shows us that we're going to have to not only do mortality reduction interventions, but we're going to really have to focus on education and fertility reduction interventions if we are not going to aggravate this particular problem. So let's use the number instead of 45, 39, and realize that somewhere between 2050 and 2070, half of all the children in the world will be on the African continent. A very important thing that very few people understand. So if we look at basic health indicators, what we do is create these numbers to look at countries and populations. And and there are many that we look at, but if you just look at life expectancy, obviously people want to live a long and satisfying, productive life, and that's what you want for your children. Certainly, you want as few as possible of children to die. And in the developed world, if you wish, life expectancy is frequently around 77 years of age. Infant mortality can be down below 10 children dying per 1,000 children per 1,000 live births. So out of 1,000 children born alive without developmental problems that cause them to die either during birth or before birth, if you look at 1,000 live births, only about 10 children out of 1,000 will die in the developed world, and obviously higher in the developing world. And the under five child survival in the developed world, 99%. And then you see things like children fully immunized, 99% in the developed world. So this is an actual country, and we will get back to what who this country is later on, as there will be a complete a video dedicated to how this relates to what we're doing in Kenya. But this is basic health indicators that we would like to see happen in the developing world. If we could do that, those would be very successful numbers. Now, we talked about the front-loading versus back-loading of healthcare investment. And I want to re-emphasize this again, this redundancy for emphasis. So many people in the United States, wherever I go and lecture, don't understand this, including health professionals, that in the United States, 80 to 90% of our healthcare investment is spent in the last year of a patient's life. And we, of course, that backloading then of our healthcare investment is very inefficient because by definition, you're only buying with that money 1 year of life, and frequently that's not a good year of life. So what we're going to do at Hope Corps and what we're going to advocate for the developing world is that we front load all that investment, that we focus that investment on the early years of life and the mothers that are so important, not only to delivering a healthy child, but to keeping that child healthy through that child's development and educating that child, not only in reading and writing and mathematics, but in important health care behaviors that that child will then carry for the rest of his or her life and transmit to their children. These would be drinking safe and disinfected water, using soap, proper sanitation, human waste disposal. Those are the kind of things then that become very important for a culture in the developing world moving forward. Now, this is an extremely important slide, and it's a slide I show pretty much every lecture that I do on global health at Stanford and other places like the Mayo Clinic and other universities. And what it is female literacy and child mortality and that relationship. And if you notice, this is data from 1985. And nobody would go to a modern medical school and ever and present data from the 1980s. But I do this on purpose because what it shows is how long we have known about this and basically how little we have done as a global health community since 1985. And if you ask me, one of the major mistakes we have made in global health, having seen global health in the 20th century to the 21st century, it would clearly be that despite what we've said, we've done very little to focus on educating mothers, not necessarily again in reading, writing, and mathematics, but the important things that they need to know to keep themselves and their children healthy. Things like, how is malaria transmitted? Why you sleep on a bed net if malaria is in your area? What is clean water? Why you want to give your children clean water? Why you want to breastfeed exclusively for 6 months and then be very careful when a child comes off the breast, what kind of water and food you provide that child. Also, hand washing, the importance of not just rinsing your hands, but washing your hands to get the bacteria, the viruses, the parasites off so that is not spread through the family. So let's just take a look at this. What it simply shows here is that this is the mortality rate of children under 5 years of age. And if we look at female literacy, if the mother's literacy rate is below 20%, almost a quarter of those mothers' children will die in the first 5 years of life. A massive loss of life, a massive mortality. On the other end of the chart, if you see that 80% of your mothers are literate, then only 29 out of 1,000 children will die in the first 5 years of life. So there's a huge discrepancy here. And we'll probably do a whole 20-minute presentation on this, and we won't leave you in 1985. We will present data from the last few years showing that this relationship still exists. And it's extremely important. It's one of the pillars of Hope Corps' program, and one of the reasons we have won these awards is that our focus on educating women and children is absolutely essential, as you're going to see, to making significant dents in both blunting this tsunami of children that are approaching Africa, and also decreasing the morbidity and mortality for the women and children who live there at this time. So we've talked about Hope Corps' program. I want to talk a little bit about the award we won, because the reason it's important is that it really it means that an independent panel of development and health experts have peer-reviewed our program. So this is not just our good idea. This is not just my good idea. This has been seen on the international arena and has been chosen as an outstanding program. And I think it's important for you to know that, because as you spend your time, hopefully, to look at these videos, you can realize that there have been people besides us who have really set our program apart as important. So In late 2015, there was a international online grant opportunity. It was open to anybody, anywheres, nonprofits, universities, private individuals, and there were $500,000 grants as prizes for those organizations whose program would be selected. There were over 430 type of 430 applications. They came from nonprofits much larger than ourselves. There came from universities, and it is extremely important to note that when they actually decided on the winners, our program, as small as it is, won for our child maternal health program. And it's extremely important because of the fact there were universities and very large nonprofits. The universities that you would know about, Cornell had an application, Johns Hopkins School of Public Health. These are very respected institutions, and here a small Village Hope Corps International, working in a backwater of Africa, 516 villages, wins over these very well-known and very large institutions. So a great honor for us. And the thing that I want to focus here is that it points to a peer review of what we're doing. So one of the most critical aspects of what we're doing at Hope Corps is that we are doing a multi-dimensional integrated health delivery system. And this is extremely important because my history in the 20th century, moving into the 21st century, is consulting programs all over the world, in all 6 continents, where I see over and over again the lack of integrated multidimensional approaches to health. And what this simply means is that so many of the programs will focus only on HIV prevention. They'll focus only on clear water. They'll focus only on immunizations. They'll focus only on child maternal health. But in actual fact, to keep a group of people healthy for a long period of time, like a child from the day of birth until he reaches at least 16 or 18 years of age, then you need multi-dimensional interventions to make that happen. That child has to be well nourished. It has to have clean water. It has to really be breastfed in the developing world. It has to have basic healthcare accessibility. The mothers need to know about spacing their children, about having healthcare services when they become pregnant, and knowing how to have a healthy pregnancy, a healthy delivery, and then to take their children through the first critical year of the child's life. So we basically at Hope Corps have taken on a whole school district of 50,000 students, in 200 schools, about 130 to 140 elementary schools, the rest being secondary or high school. Total population of children, 50,000. And we've also then taken on all the mothers of those children, of which there are going to be some 40,000, depending on how many children they have in school. And we're also taking on all the mothers that are either pregnant or have preschool children that live in that area. And so that's how, when you really look at it, we're probably over 100,000 women and children that we deliver services to. And we are delivering services to that mother and that child from the moment of conception, from the moment the woman gets pregnant until that child leaves secondary school, which can be at 18 years of age, taking care of both the child and the mother through that significant and critical period. And if we had the funds, we would of course take care of men and older women and extend that beyond the 18-year mark. But because funds are very limited, as you're going to see, we need to focus on a certain group of people. So health education, preventative modalities, and curative services. I think those are the three things that we are going to look at. And as you're going to see in a complete video that we will do about our program, is that Hope Corps, when we started this in the year 2000, some 18 years ago, we focused on economic development with a Grameen-style microenterprise bank, which we will talk about in detail, which has been very successful. It's been going for 18 years, and it has a repayment rate greater than 92% over 18 years, which is higher than any repayment rate for U.S. mortgage or other loan programs in the United States and in the Western world. So it really focuses on that poor people and that these Grameen-style banks can be very successful in the developing world, and you get the money right down to the families, women and children who actually need this kind of economic development. So economic development was one, and then obviously the second thing was healthcare, because people who are ill cannot work, people who are ill cannot get a proper education. So economic development with this bank and healthcare services that we're going to talk about in detail in a second, very important. And the third leg of what we call the tripod of development in Kenya, which would be economic development, healthcare services, and education. The reason I make education last, because in many ways it is the most important, because as you're going to see that for healthcare, particularly basic healthcare in the developing world, education is what drives the people to be able to get the kind of healthcare numbers that we want. That is, it is education that tells a woman that she needs to give her children clean water, that she needs to wash her hands with soap and teach them to do that, that she knows to put them under a bed net, that she knows the importance of breastfeeding, of child spacing, if she understands how she can control her own fertility. That's all education. If you look at the economic side, you'll see that many of our women, and most of our, in the bank, about 85% of our loanees are women. But for both women and men, if you're going to do a milk cow project or a poultry project or an egg laying program or improve your cornfield or your tea field or your coffee field, understanding how that is done using modern methods of agricultural and livestock production then become extremely important. So we're going to take this tripod of development. We're going to choose a very important economic development program, which is a Grameen-style revolving loan fund village bank. And we're going to combine it with a very innovative and efficient healthcare system, and we're going to spend a lot of our resources at Hope Corps for educating women and children. And that is a very potent cocktail for development. So we're going to look into all those aspects in detail as we move ahead. The other thing that we have done is we've rooted ourselves in the community. And over 30 years of doing consulting, that one of the main reasons programs that are designed in the United States and Western Europe that fail in the developing world is they never give ownership to the people who are actually in the field, the people who live there. And our program has been deeply rooted, as you're going to see. Our bank for 18 years have shown the people in our area that they can trust us and that we can make their lives better. We have an extremely close relationship, as you're going to see, with our local school system and school district. We've won multiple awards from the Ministry of Education for what we have done in the schools. We allow them to take part in our program and to help design the program with us. We are now embarking on a teacher health coordinator program where we'll be working with the school district to teach teachers about healthcare. And we are trying now to fund a program where every one of our 200 schools will have a teacher health coordinator. That teacher then will be responsible for all the health related things in the school. They'll be responsible for the treated drinking water, for having hand washing stations near the latrines, for clean and functioning latrines, for health clubs, and for basic health education. And we're right now funding, we're looking for funds for that particular program. So let's again pause here, and then we will come back and pick this up again as we move along with our core concepts in global health. This will be the end of part 2, and we will re-pick up here and begin part 3 in our next presentation.